Most men, at some point in their lives, wonder whether there are any scientifically proven methods to improve male size. And this topic has grown into one of the most searched questions on the internet, mostly because there is a huge gap between scientific reality and the unrealistic expectations created by online media. To truly understand what is possible, we first need to understand what is normal, because normal variation is much broader than most people think. Large population studies involving tens of thousands of men from different countries show that while over half of men report dissatisfaction with their size at some point, more than 80% of their partners express complete satisfaction, revealing a major psychological mismatch between perception and reality. A significant portion of this insecurity comes from comparison with adult content, social media exaggerations, and peer pressure, all of which distort the collective understanding of what the average male body looks like. Many men who believe they are below average are actually perfectly normal, and this misunderstanding can create a type of body-focused anxiety where someone spends excessive time worrying about their appearance, even when there is no medical problem. This anxiety can affect relationships, confidence, and mental well-being, so the first scientific solution is education. Understanding that the natural range of variation is wide and that most individuals fall squarely within it. Studies show that with proper counseling and accurate information, many men no longer feel the need for physical treatments, because their insecurity was rooted in misperception rather than actual anatomy. Now let's move into the core of the topic. What, if anything, is scientifically proven to increase size? According to medical literature, there is only one non-surgical method with consistent evidence, and that is traction therapy. Traction therapy involves a mechanical device that gently stretches the tissue for several hours a day over the course of 3 to 6 months. Research shows that men who use the device consistently can experience an average increase of around 2 centimeters, which is modest but measurable. The reason traction works is because of a principle known as tissue remodeling. When gentle, continuous force is applied over time, the body responds by gradually adding new cells, allowing for lengthening. However, traction requires dedication, patience, and proper usage because incorrect use can lead to bruising, numbness, or irritation. It is not a quick fix, and the results vary based on consistency, device quality, and individual biological differences. Beyond traction, scientific evidence becomes very thin. Pills, supplements, creams, and oils marketed online have no proven ability to increase size permanently, and many of these products are unregulated, meaning they may contain harmful ingredients or contaminants. These products often rely on temporary effects like increased blood flow, which may create a short-lived sensation of fullness but provide no structural change. Vacuum pumps are another commonly searched option. While they can temporarily increase size by drawing blood into the area, this change is not permanent. They are medically used for erectile function in certain patients but have no effect on long-term physical dimensions. Injections are perhaps the riskiest category. Whether it's fillers, silicone, fat grafts, or any injectable substance, the risks are extremely high. Medical societies warn strongly against them because they can cause deformities, scarring, infections, nerve damage, severe asymmetry, or even long-term loss of function. Some men who undergo these unapproved injections require corrective surgeries that are complex and sometimes unable to restore normal appearance or function. When we look at surgical options, the situation does not improve much. Techniques such as cutting the suspensory ligament or adding grafts and implants are described in medical literature, but the outcomes are unpredictable, complication rates are high, and satisfaction levels are low. Major medical organizations do not recommend these surgeries for cosmetic reasons. They are only considered appropriate in the setting of a closely monitored clinical trial where safety protocols, data collection, and follow-up care are supervised by experts and approved by ethical review boards. Even then, results remain inconsistent and risks may outweigh benefits. All of this leads to a critical point. The most effective approach for many men is not physical change, but psychological support and education. Studies show that when men discuss their concerns in a structured, supportive environment, their anxiety decreases significantly because they realize the actual issue is not their anatomy but their perception of it. This psychological improvement often leads to greater confidence, better relationships, and healthier self-esteem. Understanding the science behind what is normal and what is possible can dramatically shift a person's perspective. Confidence, communication, and emotional health play a far greater role in overall intimate satisfaction than a single measurement ever will. When men focus on overall wellness, better sleep, mental clarity, regular exercise, hormone balance, and improved cardiovascular health, they often experience better performance, energy, and confidence regardless of physical changes. With that said, here is the scientific bottom line. There is no fast, simple, or magical solution. The only evidence-backed method for increasing size is traction therapy, and even that requires months of consistency for modest results. Surgical options remain high risk and unsuitable for routine use. Injections and unregulated procedures are dangerous and should be avoided entirely. Supplements and topical products have no proven effectiveness. For most individuals, the most powerful solution is understanding the natural range of variation, addressing body image anxiety, and improving overall wellness. Your health, safety, and long-term function matter far more than any number, and making informed, responsible decisions is essential. Never allow online pressure, misinformation, or comparison to push you toward unsafe treatments. Take time to learn, understand, and appreciate your natural body, prioritize mental well-being, and always consult a licensed medical professional before trying any medical or mechanical intervention. Your body deserves safety, respect, and care, and when you protect your long-term health, you make the best possible decision for yourself and your future. Thank you for watching, and always remember to take care of yourself because your well-being is worth protecting.